Everybody hear me? I'm just going to say, is this okay here?
Sounds great.
All right.
So I did hit the record button. 3, 2. All right. I am live with Rob, Will, and Raj, and this is a fun little experiment that we've got going on here. Rob, I'll fill you in real quick because you are the guru, you are the master, the founder of PT Live and the chat website interface of the future. And I really just wanted to kind of see how this is going to go. So, Rob, what I'd like to do is just kind of let you know, man, I've got this nagging injury. It's been going on for 6 months. It's a knee injury in my left knee that doesn't really cause severe pain. It's something that started out more kind of as a nuisance. And it's kind of a clicking sensation that I get with certain exercises. I'm a pretty fit guy. Mm-hmm. The exercises that I noticed at first with included running and squatting.
Okay. Can I dig in a little bit?
I absolutely would love to know what I could help or get help with.
Yeah. All right. So first off, so you're 28? Is that what I saw? Okay. Gotcha. And when did it start?
About 6 months ago. I was running a lot in March and April leading up to June when I really ran a lot.
Okay. Now, was it a single instance where you were like, oh, yep, I know exactly when it happened, or it just progressively got worse? Or
I'd say it kind of progressively got worse to a point where then it actually kind of plateaued, and it's definitely activity dependent. It's involved at certain points during the weeks when I'm really working hard, and then it's kind of easy for a couple of weeks if I'm not doing much.
Okay, gotcha. What about when with running? Let's break down the two things that make it worse. When you're running, is there a certain mileage, or is it just sprinting? Does it warm up and get better to the point where it doesn't hurt you after mile 1, and then after you stop, it's horrible? Or describe what you usually feel with running first off.
Yeah, I think something really easy for me to identify is after longer durations. So the longer I'm running, the more of a nuisance I notice it, but it's never really while I'm running. If I start running and it's a pretty low level ache, no matter how long I run for, it'll stay at a low level ache or really even nothing sometimes. But if I run for 30 minutes, it can be like a pretty decent, burn like muscles, but in the knee joint. I know it's not a muscle. It's kind of in the joint.
So after you finish running, is it inflamed? Does it swell up? What happens to it after you're done?
It doesn't swell. No.
No swelling? Okay. Does it ache like a headache or a toothache in your knee after you're done running? Or no? If you're off of it.
I'd say it's more of an ache, and it's kind of like right on the outside. And it never really transfers to the inside. It never really seems like it's under my knee cap. Mm-hmm. Definitely more on the outside, low level ache.
Okay. Always kind of in the same spot, like you could put one finger on it and go, it's right there every time that it hurts?
Yeah, it's no bigger than like a big quarter or so.
Okay, so lateral knee spot.
Mm-hmm.
And then how about with squats? Does it do the exact same location?
No, it's really interesting. So here's the difference, right? The running brings on this low level ache. Squatting, though, brings on this clicking sensation. And I've had a few folks look at me and work with me through the squatting pattern. And it never really hurts per se when I squat, but it really makes me feel uncomfortable. And I know, Rob, every single time I squat, it's going to happen. And it's always at a certain depth.
Okay, gotcha. Is there, if you do a whole bunch of stretching beforehand and then you do squats, is it like, it's not as bad? Or is it just the same regardless of what you do?
I want to say that it depends on what I do beforehand or even, mid workout session. Sometimes I can kind of make that click less intense. Sometimes it's just really intense and I kind of shy away from squatting when it's like that.
Okay. And then after finishing a heavy leg day or a heavy squat day, is your knee after you're finished with that the same as it would be if you went on a long run? Like same sort of pain or totally different or no pain at all?
Yeah, no, I think it definitely is a similar type of ache. The location's the same.
Okay.
The sensation's probably the same too, maybe just different intensities.
Gotcha. Okay. What about the next morning after you finished a run or a workout the next morning? How was it?
I just push through it. It never lingers into the next day. Maybe that's a good way to put it.
Perfect. All right. And any loss of range of motion when you do it? So it's horrible. It's sore. It's at its very worst that it's ever been in the last 6 months. Do you lose range of motion when that happens?
No.
No? Okay, cool. Easy. All right. I mean, it's sounding right now like it's just a typical tendinosis, and it's just basically the tissue in some spot got weak or got torn. Frankly, who gives a crap as long as we can figure out what it is and how to get it better? That's the whole thing. Don't worry about like, oh, what might have caused it. So my whole goal is I want to see if we can, I guess, not irritate, but create your symptom by doing a specific exercise, and then see if you do or don't lose range of motion. And then we want to see if it's one of two things. It's either going to be a derangement, which in McKinsey terms means there's some goofy thing going on inside the joint itself, which it doesn't sound like, just because it's always in one location on the outside of the knee. So if it was something that moved around all over the place, that's kind of indicative of a typical derangement or something that's wonky inside the knee joint itself. But if it's just something that's always one spot and it's spot dependent, you can point it out every single time and it doesn't change, it's probably not damaged. I don't like to use the word damaged, but it's a piece of tissue that's weakened and it hasn't healed all the way back yet. So typical tendinosis sounds like what it is, but I'm not going to be completely sure until we test it. And then I'll give you some homework, like one thing to do, and then we'll check it like every week. We'll give a check-in and see how it is.
Yeah.
So, questions for me so far?
Well, I've had a lot of folks look at it, and I kind of am buying into your idea of disregarding what exactly might be involved in terms of tissue, because
you'll never figure it out. MRIs won't even tell us. MRIs like a telephone. All we know of a picture of a telephone, we know it's a phone. We have no idea if it's ringing. So that's the whole thing with imaging. So in that aspect, that's why I always tell my patients, I'm like, don't worry about it. It's not a big deal. Imaging isn't going to tell us anything unless you have a big fracture or a tumor. All it's good for. But when it comes to anything that's a musculoskeletal issue, don't worry about it. I'm glad you don't have a tumor, and I'm glad you don't have a fracture. So these are all good things.
Yeah, and it's definitely, like I said, it's plateaued to the point where now it's more of a nuisance than anything else. And I've been trying some different homework type things, like you had mentioned. I'm not sure what you might recommend, but I do feel like it's at the point where it's just pissing me off. I want to. I don't care what it is.
Right. Yeah. Does it bother you to the point where have you tried CHO pads or some type of brace or anything like that? Or is there anything that you've tried consistently in the last 2 weeks?
Yeah. So no bracing, but I've tried, and Will can attest to this. He's worked out with me a couple of times actually in the last month and a half, where I've been able to modulate the intensity of the click with banding type work and different pressure points to kind of minimize perhaps contact and stuff like that. But
I gotcha.
No bracing.
But you couldn't necessarily equate the click with the exact location of the other pain that comes along?
No, I think the
Could
click.
it be just that you have two knees and one of them just clicks and it happens to be the same one that hurts?
I mean, it very well could be, because like you said, the clicking, or I guess you identified, the clicking that occurs during squats does sound like there's some type of tendonish issue. But the low level ache with running, what makes no sense in my mind is I can get the same sensation the 3 hours after either squatting or running, but I do not get any of the clicking. So in my head, it's almost like I don't need the click to get the ache. Right. I can get the click without the ache.
Yeah, that's what kind of leads me down that path of kind of wanting to disregard the click, because you get the symptoms regardless.
Right.
Is that the thing? Yeah. Don't say irregardless. It's regardless, right?
Irregardless.
Regardless of if you get the click or not, you still have pain after. Okay. So 6 months worth. Have you had any period of time, like in the last 6 months, where you've had a whole month where it's just been awesome? Like it didn't hurt at all?
Yeah. I ran a shit ton in May,
I saw that.
June. After that, I was like, no more running for a little while. And I did taper down a little bit, so it wasn't like a cold turkey stop. But I did notice the level of ache was of less intensity for the subsequent 2 months or so.
Okay, gotcha. So when you backed off the running, the pain backed off.
Yeah, but when I was running, I didn't really take a break from anything else either.
Right.
Still
Right.
sprinting, lifting, doing all that.
Okay, cool. Any kind of crazy medical history, anything that's happened in the past to that knee specifically? Old surgery,
No, no,
injuries?
the normal, wannabe athlete type stuff.
Right.
They twisted this, strained that, but
Right.
nothing severe.
Okay. This isn't an on again, off again thing for years. It's just the last 6 months.
It actually though the chronic clicking, I will call it, has
Mhm.
been there for. Honestly, I'm thinking back to when Will and I and a couple of our classmates started playing squash was when I really started to notice, oh shit, this is something that's more than nothing. That
Yeah.
was about 4 years ago, 3 or 4 years ago now.
Okay.
Never really bothered me with anything else, including the squats. That was never a problem.
Okay.
But
Gotcha.
the last 6 months, definitely.
Yep. Um, any kind of crazy fevers, headaches, any falls or stumbles, anything like that? Any
Mm-mm.
neurological issues, numbness or tingling down that left leg?
Forgetfulness of the whole
Yeah.
mind and body.
Anything with your back on that side that can shoot down to the leg, or any back pain on that side?
Not during the 6 months. In times past, some weird back stuff and joint stuff in the low back that
Okay.
I don't
But
want to
nothing
see.
currently that's like back and knee, but I'm just talking to Rob about the knee right now.
Correct. No, none of that.
No bowel and bladder stuff, anything
Mm-mm.
out of the norm there.
Mm-mm.
Sleeping normal, any new dietary stuff?
Mm-mm.
Nah. All right. Okay, cool. So that's pretty much my basic collection of info. Like, I have a really good idea. I think you have a tendinosis, and now I'm just going to test the crap out of it to figure it out. What I do have, do you want me to share a screen and show you something that I would usually show my patients that'll have a tendinosis?
Yeah, I think have you shared this video before? Because I think I've seen it and I really like it.
Is it the one with the little pink band? Where is this sucker? There it is.
No, I might have
Okay,
seen your inflammation video. Maybe that's what it is.
let me mute this sucker. Can I share screen? I can. All right, let's see. How about this thing?
I am
So,
seeing
all
your screen.
right, you got
Yeah, I
it?
can see it.
Okay. So this is my little model of a tendon, right? And those black stripes, those are just normal everyday tissue, right? And then you get an injury, and that's what happens. So you get this little glob of scar tissue, and you can still move through it. It's fine. You can still move around, but if you move too much and you pull on it too much, it creates a little bit of inflammation. Not enough to where the tissue tears or has any sustained damage, but it irritates that little piece right there to the point where it flares up, gives you some inflammation, flushes out by the next day, and you're fine again. Okay. So it's kind of like the internal scab that tears off, the scab opens up, creates another scab, you're fine until you run again, and then the scab opens up again. So what we're going to try and do is we're going to try and transition that tissue by doing a repeated movement. If you have a dysfunction, what it'll do is you'll do some repeated exercises and your body will start to lay down better collagen and kind of scrap out the old scab that's sitting there right now.
Okay.
So then, go ahead.
No, I was just jotting this down.
Yeah. And then basically it'll transition from that old scabby material here. And then once you do your exercise, sometimes it'll take 4 to 6 weeks, but it'll steadily get better and improve to the point where it's all normal collagen again, and it can stretch and pull and take all the load that you want to give to it, and it has normal tensile strength, and it won't get inflamed and tear because these fibers are now the same, just like it was at the beginning,
Mm-hmm.
and there's no more of this glob of crap in there anymore. Does that make sense?
It does. It almost feels like that's what my IT band / whatever other tendon on the outside of that knee is doing.
Yeah. Whatever's happening with it.
Yeah.
All right, cool. So what I want to do is I want to see if you can stand up and squat with both legs first, and then we'll see if it gets your symptom.
Okay.
And can you step back a little bit, I guess, and just kind of point out where your pain is on your knee?
Yeah, I'm going to take my headphones out. Do you want me to do like maybe 10 of them?
Mm-hmm.
And I'll kind of just point out at what angle and where.
No, just one. I just want to see one first. Yeah. Let's just see one first instead. Let's see. Angle that sucker down there. There you go. That one right there. Gotcha. Does that hurt already? Oh, you can't hear me. You don't have your headphones in. Duh. Does that hurt already?
The click. No pain, but definitely the click.
Just a click?
Yeah.
Okay. So is it right at that location where the tie-in is of your lateral quad?
Yep. Take your headphones out.
Yeah, I don't
I was going to say, if you want to unplug your headphones, that way you could hear me if you want.
You guys are geniuses. So where I'm getting it's right in here.
Okay, gotcha.
Click's actually kind of coming from right around here. The soreness kind of starts here. If anything, it'll migrate from like that small little pinpoint thing right on the outside of the kneecap, a little bit higher up, right into here.
Okay. Okay, gotcha. So if you did like a single leg squat where you held on to the back of the chair there and you did like literally one leg up and you did a little single leg squat, try that and do a few of those until you get just a twinge of your symptom. Can you hear me okay?
I can hear you.
Okay, cool.
So I can pistol squat it all the way to the ground. You want me to slowly go before I get the twinge?
Yeah, just go down to the point where you get the twinge and then right back up. And you can hold on to stuff. It's fine.
So
you can hold on.
It's going to pop there.
Yep. Okay. How about pain?
I don't want to call it pain. I'd almost call it just that nuisance.
Okay. So you can tell it's somewhere around that spot that you normally get symptoms.
Oh, it's the same exact spot where the achiness. Say I did that with a lot of load for a few days in a row, I'd pay for it.
Okay. All right. Cool. Perfect. So with load, you can get your symptom at your spot that hurts you after running or squatting heavy, right?
Yes.
Okay. Perfect. Yep. So I would start with a theory that it is a tendinosis because it's always in the same spot. It's brought on with load. Repeated load hurts it a bunch. Heavy load hurts it a bunch. It never lasts more than a day. It doesn't make you lose range of motion. It doesn't sound like anything inside the joint itself. So what I would say to try on a repeated basis would be to start with almost like a small, because you don't really get the symptom, or do you get the symptom whenever you're doing a little squat with both legs? Like whenever you first did it with both legs, did that hurt you in that spot?
No, that didn't hurt.
It cut out. What'd you say? No.
Are we good now?
Okay, gotcha. So I think so, yeah. So it was just with the single leg squat.
The click was more intense with the single leg squat, and I will say there's a visceral, I don't like it type sensation. Yeah. The pain, definitely more dependent on the load. Does that make sense?
Okay. Yeah, totally. So I'm going to throw out the clicking just so I can differentiate the two.
Sure. Sure.
So your symptom, whenever you're doing that single leg squat, it brought about a little bit of your symptom or no?
Yes.
Okay. Just making sure I heard everything right.
Yeah.
All right, cool. So what I would do is I would, and this is going to sound nuts because it's a lot, but about 6 or 8 times a day, I'd probably do between 5 and 10 single leg squats to the point where you just get that ouch and then come back up. I don't want you to go through that pain point, and never mind the click. I don't care about the click.
Yeah.
What I care about is you squatting down to the point where you get a little bit of your pain, a little bit of your symptom, and then come right back up. And then I want you to go down, get it right to the point where you get the, and then right back up. And I want you to do like between 5 and 10 repetitions. If you can do 10, that's fine, as long as you're getting some sort of symptom every single repetition. So if it takes 5 repetitions before you feel it, do 5 more so that you at least get 5 good repetitions.
Gotcha.
And I want you to do that between 6 and 8 times a day, at least an hour in between each set.
So the effective dose, you're saying maybe it's first thing in the morning 5, and I get all 5 of those to be a little symptomatic, but later in the day, let's say I'm moving around, you want me to hit a good 5, even if the first 5 aren't bad.
Right. Exactly. So if you hit those first 5 and it's like nothing, oops, there it is. Start counting at that one.
Right.
And then each day, if you can add a few more to get a total of between 8 and 10 repetitions of the ouch during that squat, I want you to advance it to 8 or 10. You're already doing heavy squats. You're already doing runs, and you're not getting worse to the point where it lingers the next day. That means that this tissue has a lot of tensile strength. So we're going to have to load it more than the normal person. Does that make sense?
Yeah.
So that's why it's never changed and has never resolved itself, is because you're able to give it just enough load to piss it off, but not enough load to make the body stimulate collagen production to scrape out the crappy collagen that's still sitting there with that tendinosis, and then make better solid collagen with more tensile strength to where it doesn't hurt anymore. Kind of going from that pink little thing that I was showing you on the video, that pink glob, to the black straight across lines back to normal.
Yeah.
So that's what I would say to do. If it gets worse, let's say you do 5 or 10 repetitions, it should bump up your symptom a little bit, but it should come right back down within about 20 minutes max.
Okay.
So if it gets worse and it lingers and it's an hour later and you're like, damn, my leg still hurts in that spot, skip a couple of rounds. Okay. I don't want you to do them if they're sore. So if that leg is sore, don't knock out a round. I want it to be a 0 when you start. Make sense?
Yeah, you bring up a good point there. I think the 6 to 8 times a day is a lot. I'm physically doing it all the time with patients and the demonstration, stuff like that. I think if I was to picture a week's worth of work, Rob, where I've got maybe 3 days where I want to lift some weights and do some heavy stuff, would you make any recommendation to your prescription to be modified to keep with it?
I do the same stuff. As long as you adhere to the guidelines of, if it's worse after 20 minutes, take a few hours off. If it doesn't get better, even after hours and hours of resting, take a full day off. But as long as it does this, it gets a little worse when you do the activity and then it goes away within 20 minutes, you're fine. Throw the kitchen sink at it, because it needs that deliberate repetition over and over again to remodel. It's like every time you do a set, your body's like, hey, fix this. Hey, fix this. Hey, fix this. So you have to give it more and more load in order for your body to respond and actually fix the issue.
It makes a lot of sense. How long do you think, in your experience, this is something that's been, I don't want to say resolved?
Since you're high level and you're able to do stuff and it does not explode on you, you're like 75% of the way there already. Right. So all you have to do, and I've had these personally, I played busloads of racquetball when I was 2-3 years out of school, and I got bilateral patellar tendon tendinosis, and it trashed me. It was horrible. And I was the dumbass that basically was like, oh, I just put some ice on it, I'm fine. And then I was like, you idiot, you know how to fix this. And then I did like mini squats for 2 weeks and it was fine. Playing racquetball, totally fine. So it's just that excessive load, like setting a timer on your phone. Every hour, man, knock out 10. Hour goes by, knock out 10. Here's the big key. Do not, at the end of the day, if you haven't done 6 or 8 rounds, don't do all of them at once. Don't, because that will explode the tissue, make it pissed off, and then you have to start all over again.
But
no.
I think that's super helpful from PT to PT to obviously identify the big factors that are kind of, in the back of our minds all the time.
So it needs to be deliberate. Yeah, absolutely. It needs to be a deliberate set every time. So it's not just throwing in a total amount during the day. It needs to be deliberate set, rest. Deliberate set, rest. That's the only way your body remodels that stuff.
Yeah. So aside from the specific regiment that now I'm going to set forth for myself, heavy squats, yay or no?
What'd you say?
I'm sorry. Can you hear me?
Yeah, I can hear you. If you can tolerate it, man, do it. So
I mean, that's the thing. I know I'm changing my mechanics.
Just play around with it.
I can tell it's going to happen. I know it's going to happen. I shoot through it.
Don't worry about the mechanical side of this. It's not anything other than a hole in a tire that needs a patch. I mean, it just literally, it's that. Don't worry about specifics or changing anything else. Let's be real specific so we can do one thing and figure out that one thing changes and fixes it. If we add 5 things and you get better, hooray, you're better, but we have no freaking idea what of those 5 things actually fixed it. So just one change. Keep your exercise routine the same, do everything the same. And I wouldn't normally say this to people that are, doing exercises and activities and exploding for the next 3 days. And they're like, I can't even walk on this. I'd be like, all right, we got to back all the way up. But since you're already doing high level stuff and you're not trash the next day, just keep the regimen the exact same you've been doing. Don't change a thing other than adding these.
Right. Being that this is the first telehealth consult visit thing that I've ever done, you said you'd recommend kind of tracking this about once a week or so. No, is my internet still letting me?
Yeah. There it is. It's back.
There we go. So what I was asking was, you said it about every week. You'd like to kind of just track to see how things go.
Mm-hmm. Yep, definitely.
You recommend doing that via telehealth consult? I don't need to go get an MRI and an X-ray and a CT scan?
Nah, no. Just this.
I really wanted
this
one.
Will fix you up. But this is a typical. I mean, this is what I would see even 10 years ago when I had people on yachts that were getting a hold of me. It was always like a shoulder dysfunction, a knee dysfunction, or a back derangement. So it was always like press ups, doing something to fix a tissue dysfunction in the shoulder, or exactly what I'm giving you now.
Yeah.
So it's just dose and load dependent, and then checking up once a week. You're active, you're going to do this. So it's just having those initial, everything I've written down here, just baselines, and then we'll check it in a week and see if you can reproduce your symptom. Because just a couple of pistol squats, you were able to reproduce something.
Oh, yeah.
So if it next week takes you then 10 for you to go, okay, now I feel it. All right, we know that tissue's gotten stronger. Make sense?
Yeah, absolutely.
So, yeah, we're just going on the...
From this point on, obviously, I think if Raj and Will have any questions or any follow-up comments, I'd love to hear theirs. But I think let's just give them the floor.
All my questions are just more clinical to Rob. I've seen Scott
Herbawi.
Yeah. I've seen him do a couple of these in person. Why didn't you check repeated extensions with overpressure?
Because when I was digging in repeatedly, he said there was no range of motion loss. So especially doing heavy squats, if there's a knee derangement internal and he's doing heavy squats, it will actually get stiffer and stiffer and then start to ache because literally the joint is not working properly. And that's a mechanical issue. But with him saying, nope, not stiffer, and he can run for a long time and he gets worse after, it's just that pain pattern of tissue dysfunction with that delayed symptom or something that warms up and then after it hurts, after the completion of the activity. That's where I would have dug into. If he just said anything that even remotely sounded range of motion loss, I'd have checked that right away.
Got it. And what about what's plan B? What if next week there's negligible change? How would you add overpressure?
I'd probably get him to do something with heavy backpack with some extra weight.
Makes perfect sense. Got it.
Something with extra weight.
This is why I love MDT. This is why I love it.
Even holding a kettlebell and doing some bilateral squats, we'd see if that would get it enough force. So it's just fluctuating and changing force. That's all.
Yeah. Got it.
Will, any comments for you? I got a few minutes left on my recording.
Mine are more technical, Rob, in terms of billing software. What would you do this through? What would you charge someone? And is it legal / how do you make it legal? Yeah.
So what I'm doing right now is through,
Rob, I don't mean to interrupt.
You go through Amwell and then virtual PT or virtual physical therapist. That's okay. No worries.
I'm running out of time. I don't want to, does everybody have an extra 10 minutes to answer with Will's question real quick?
Yeah, tons. You want to hop back on?
Yeah, I'll send this one again real quick. Thank you so much.
Let's do it.